Good evening, and welcome to this County of San Diego Monkeypox Town Hall. Thank you for joining us. Let me introduce myself. I am Eric McDonald. I am the Chief Medical Officer for the County of San Diego Health and Human Services Agency, and I'll be your moderator for this evening. Our purpose today is twofold: to provide you with the most up-to-date information that we have on the monkeypox outbreak affecting our county, state, and nation, and to listen to your questions and concerns about this public health emergency. Before we begin, a few housekeeping rules and a few things to keep in mind. Interpretation is available tonight. There is a tab at the lower left of your screen that says interpretation. This is available in Spanish, Somali, Arabic, Mandarin, Korean, Farsi, Tagalog, and Vietnamese. And even if you're listening in English and are not using the services, please go to that tab and click English. That'll help us with a good recording for you. If you would like to submit a question, please use the Q&A function in this webinar. And you do have the option to submit a question anonymously by clicking the anonymous box. This is a public forum that is being recorded, and the recording will be available soon on the county's monkeypox website. So with that housekeeping information out of the way, it is my great pleasure to introduce County Health and Human Services Agency Director, Nick Mascione, for some introductory remarks.
Thank you, Eric, Dr. McDonald, and good evening, everyone, and thank you for joining us tonight. As the county's Health and Human Service Agency, our mission is to ensure that every San Diego resident is healthy, safe, and thriving. And I know you're here tonight because you're eager to get information, and we're eager to share information with you. We hope by the end of the event, you'll understand how to protect yourself and your community and have your questions answered. Tonight, you'll hear from our agency's team of seasoned public health professionals and doctors. Our expert team is joined by members of the LGBTQ+ community who have been important partners in our monkeypox response. Before I pass it on to them, I want to make sure you know that the county is taking our monkeypox response very seriously. As our doctors, our public health experts, and community leader will be discussing with you shortly, we've been tracking monkeypox and ramping up our response with community partners to meet the need for months. As an agency, we have a very robust infrastructure to respond to emerging health issues. And many of us speaking tonight, in fact, have helped shepherd the county through numerous health emergencies. In fact, I started my career 30 years ago at the emergence of HIV/AIDS epidemic. And I saw and learned firsthand the criticality of working together with community partners in our response. And that, in fact, is what we're doing here. And more recently, our county government orchestrated a robust and effective response to COVID-19. And although the situation with monkeypox is fundamentally different, as you'll hear, than COVID, it is important to know that we have sharpened our ability to address health emergencies through the years with COVID response. We focused on creating meaningful partnerships to get information out and to receive feedback and test, trace, and treat people across our county. And we continue to rely on our community partners throughout our monkeypox response. And one of those key partnerships is with our elected leaders on the County Board of Supervisors and in our cities. We are extremely fortunate in San Diego and grateful for their support, especially the chair of our County Board of Supervisors, Nathan Fletcher, our San Diego Mayor, Todd Gloria, and San Diego City Council member, Stephen Whitborn, and who wanted to share following messages with you tonight.
Hello, everyone. I'm Nathan Fletcher, Chair of the San Diego County Board of Supervisors. I want to welcome and thank you all for being here. I really want to start by expressing my deepest gratitude and appreciation for your participation. I believe it's vitally important that community and local governments work together. We have to ensure that accurate information is being shared about monkeypox, and we have to make sure the details about vaccines, prevention, treatment, education, we have to make sure all of that is shared. During today's event, you're going to receive information from trusted doctors and public health officials that will help you and your loved ones and those that you care about know more about monkeypox, how to identify it, how to prevent it, how to treat it. The County of San Diego is taking the monkeypox virus very seriously. We started our response at the end of May, when we began coordinating with our local healthcare partners. We began an active public information campaign. We held vaccination events with more coming once we get more vaccines, which we continue to push for. We've distributed treatment courses to hospitals and area clinics. On Monday, Governor Gavin Newsom and the California Department of Public Health declared a state of emergency in order to respond to monkeypox. Our county followed suit the very next day, declaring a local health emergency to make sure that we were aligning our efforts with the state. Taking this action strengthens our vaccine, prevention, and education campaigns and helps put us in a stronger position. I do want to point out that declaring a local emergency is not an uncommon practice for counties, cities, and states. It is an action you take that puts you in a position to leverage available resources and to move very quickly. We do it for wildfires, oil spills, earthquakes, and matters of public health. I understand the last public health emergency we enacted was for COVID-19. And more than 2 years later, it's still with us. And there are some of you at home that are saying, here we go again. But this is a fundamentally different situation and our response is different. Unlike COVID-19, monkeypox is not a new virus. It may not have been as prevalent in the United States recently, but there are already vaccines and treatments. There's already much greater availability of information. At this point, it's a matter of distributing the available vaccines, fighting for more, and getting info out as quickly as possible. After today's meeting, I highly encourage you to stay up to date on monkeypox by signing up for our text alerts. You can text COSD monkeypox to 468-311. Again, COSD monkeypox to 468-311. Thank you for attending this evening to learn more and help keep our communities safe and healthy. And our commitment to take this seriously and respond aggressively is firm and will guide our efforts as we move forward.
Hi, everybody. I'm San Diego Mayor Todd Gloria. Thank you for being here for this important informational session on monkeypox. First and foremost, I want you to know that your city and county leaders and public health officials are in touch and sharing information regularly about monkeypox. This close coordination is all with our shared goal of keeping San Diegans safe and stopping the spread of this virus. The only way to stop the spread of monkeypox is through education, prevention, vaccination, and treatment. And you all are a key component to ensuring that our community knows what monkeypox is and what it isn't, and most importantly, how to defeat it.
There should be no doubt that the county and the city are working hand in glove so that information and resources are getting out to our community as quickly and directly as possible. That collaboration extends to other leaders in the LGBTQ community, county health officials, leaders from our 18 cities, and many nonprofit organizations in the region. We're all committed to engaging with leaders like you today because we also need your feedback on how we can do things better. As members of the LGBTQ community, we're a community that understands and appreciates the seriousness of this matter. We want the community to know that your city and county government are taking this seriously as well.
As your mayor, I'd ask everyone to take the time to learn about the risk factors and take the proper precautions for yourselves and for your loved ones. We can stop the spread of monkeypox in our community. Thank you in advance for your time and your attention today.
Well, thanks, Nick, and thanks to Chair Fletcher and Mayor Gloria and Councilmember Whitburn. And I'd like to now introduce all of the members of our panel who will be presenting this morning. Am I on? Yes. Okay, sorry. The first is Mickey Lochner, who is a valued community member and is chair of our county's HIV planning group. We have also with us Dr. Wilma Wooten, our county public health officer, Dr. Anita Kadakia, our county deputy public health officer. We also have Dr. Winston Tillman, who is the medical director of the county's HIV, STD, and hepatitis branch, and Patrick Luza, who is the branch chief of the county HIV, STD, and hepatitis branch. I'd like to start with Mickey Lochner, our HIV planning group chair, and I'll turn the podium over to you.
Good evening, everybody. My name is Mikey Lochner, and as Dr. McDonald said, I am the chair of the San Diego County HIV Planning Group. I am a long-term survivor, 36 years HIV positive, the last 26 years with a full-blown AIDS diagnosis. I live in North Park with my partner, Gary, and our fur baby, Spirit. I want to start by thanking the Board of Supervisors, especially Chair Fletcher, the Public Health Officer, Dr. Wilma Wooten and her team, the County Health and Human Services Agency, especially Director Nick Marchione, and the San Diego City elected officials, especially Mayor Todd Gloria, for jumping on this issue very quickly. We are very fortunate to live in a county where the elected officials and public health department have demonstrated once again how truly committed they are to the well-being of all of San Diego. It is imperative that we come together as one and work with the county to get the message out to everyone. We need to educate ourselves and each other. When we work as one community, we can accomplish anything. Let's find a way to ensure the message going out to all is correct. It is up to us to come together and create safety nets within our community. We need to communicate clearly with each other and with our community. Remember that the hard times won't last forever. When we get intentional about doing what we can to strengthen and build up our communities now, we're doing more than surviving. We're setting the stage for renewed growth and revitalization once this health emergency dies down, and it will. One day in the not too distant future, we will find we made it through the tough times and came out on the other side stronger, better, and closer than ever. So let's be kind to each other, let's be patient with each other, and let's be graceful with each other. During this time, when it is known there is a very limited supply of vaccines in the world, we really need to work together and ensure that as a community, we present the positive actions that are being taken to protect all San Diegans. So let's join forces and help uplift the message from the county that shows all of San Diego we are united. If we stand together with the county and provide the correct information to all, we will all be winners in this fight. Yes, it's been a long 2 years of COVID-19, which is still here. And now monkeypox. People are tired, scared, and even angry, and that's okay. What is not okay is if we have the correct information and don't share it with these folks to help possibly relieve the anxiety and uncertainty they have. So please find it in yourself, get educated on what to do to help keep yourself safe until there is enough vaccine to take care of everybody, and share that information with others in the community. Thank you so much, and I turn it back over to Dr. McDonald.
Thank you very much, Mikey. And it was okay that I called you by your first name. I asked him that before we started today. Next, I'd like to introduce our County Public Health Officer, a wonderful colleague, Dr. Wilma Wooten, for an overview of the current monkeypox situation, including a timeline of the outbreak and where we stand today. Dr. Wooten.
Thank you. Thank you, Dr. McDonald. So Dr. McDonald has shared with you what I will share with you tonight. So let's move on to the next slide. Next slide. So this slide shows the most recent events that have occurred since the beginning of the global monkeypox outbreak. We will see that the first U.S. monkeypox case was reported in Massachusetts on May 17th, followed on May 20th. Following on May 20th, the County Public Health Services stood up its incident command structure for the global monkeypox outbreak. This was before we actually declared the local emergency. And the first case in California was reported on May 27th, with the first 2 probable cases in San Diego County being reported on June 15th. The remaining 4 events that are listed on the slide here are related to declarations. The first being the World Health Organization declaring monkeypox a public health emergency on July 23rd, followed by the California Department of Public Health declaring a state of emergency on August 1st. Then our county declaring a local health emergency on August 2nd. And finally, the U.S. Department of Health and Human Services declared a public health emergency on August 4th. Now, collectively, these actions allow for the availability of resources. The state of emergency allows for personnel such as pharmacists and emergency medical technicians to administer available vaccines, utilization of state resources for vaccine administration, and leveraging of the public health infrastructure related to testing, case investigation and contact tracing, and community outreach and engagement efforts that were developed during the COVID-19 pandemic response. The federal public health emergency reinforces support to the states and local jurisdictions. Now, at the onset of this global outbreak, clusters of monkeypox cases with apparent local transmission were identified in multiple countries, particularly in Europe in May of this year. This global map shows geographic areas where the monkeypox virus has historically been observed, depicted by the blue dots, compared to the current worldwide monkeypox outbreak of 2022, characterized by the orange dots. We can see that in various years or previous years, the monkeypox outbreaks that occurred in countries where it's endemic were West and Central regions of Africa, where cases primarily occur in household members and include infection of children. This current global outbreak that we're seeing is being seen in gay, bisexual, and men who have sex with men population. Globally, as of August 6th, CDC has reported 30,800 cases in about 89 countries. Now, if we look at the next slide, this shows the current case count for the United States and California. There are currently 9,492 confirmed cases in the United States and 1,310 confirmed and probable cases in the state of California. In the next slide, we want to look at local cases. And we are reporting local cases every day, Monday through Friday by 4 p.m. each day. As of today, we have now 121 cases, and this is 17 more cases than were reported yesterday. In addition to the daily case updates, weekly we will provide demographic information. And if we go to the next slide, this shows demographics of the last report that was issued on Tuesday or reported on Tuesday. And at that time, we had a total of 104 cases. Of those 104 cases, all are men. There are no female cases reported to date. When interviewed during a case investigation, sexual orientation was identified 89 or 93.7% of those interviewed identified themselves as gay or same gender loving. 3 identified themselves as bisexual, heterosexual, or straight. 2, and 1 individual declined to answer, and 9, we were not able to get that information. This is the language that's being used by CDPH or the California Department of Public Health. So we are following suit with using the same language so that we can compare data across from our local jurisdiction to the state and across other jurisdictions in the state. The median age is 34.5 years with a range from 21 to 62 years of age. We, at this time, had only 2 hospitalizations, and thankfully, we have not had any deaths. When we look at race and ethnicity, 49 or 57% are white, 33 or 38% are Hispanic or Latino, and 6 or 7% are Black or African American. And when we look at the geographic location, most of the cases have been reported from Central Region. 82 of the 104 or 79%, with the next largest number being from the South Region at 8 and then North Coastal at 6. Going to the next slide. We also want to talk about our communication efforts. Before the first cases were identified in San Diego County, communication strategies were promptly implemented. The county started an active public health education campaign to ensure accurate information and adequate resources reached all San Diegans. These efforts included launching the county's monkeypox website on June 2nd, currently providing local case and vaccination information, again, Monday through Fridays. And then the demographic information, again, is provided on a weekly basis on Mondays. We've also developed educational materials such as frequently asked questions, flyers, and we've conducted town hall videos. So there will be a video of this event posted on our website after this session is over. Now, we've also developed a variety of health information or health education materials with input from subject matter experts and partners in the community. This effort is ongoing as content changes daily, so we update our website almost daily. Materials are available in English and Spanish, and efforts are in way to translate all of our information into the threshold languages that the county adheres to. We are establishing a dedicated text alert system that enables everyone to sign up for monkeypox. And as Chair Fletcher noted, to receive these updates, just text COSD monkeypox to 468-311 to stay current with the local monkeypox data and news. We've provided timely information through news articles, social media platforms such as Facebook, Instagram, Twitter, as well as the Gay Ad Network, which includes Outview Online, Best Gay News, the Rainbow Babies, and many other media outlets. We are also utilizing Google to place monkeypox messaging, reaching a wide range of individuals. Additionally, we will soon expand monkeypox information to other methods, including digital radio. And lastly, the county has launched a digital media campaign to promote monkeypox awareness and resources to members of the LGBTQ+ community on targeted apps and websites, which include Jacked, Growl, Hornet, and many others. So now I would like to welcome to the mic Dr. Ankita Kadakia.
Good evening. I'll be providing an overview of the monkeypox virus, prevention, and test, trace, and treat, and vaccination strategy. Monkeypox is a rare disease that is normally found in West and Central Africa. This outbreak is unusual, as pointed out before, due to the large number of infections being seen outside of Africa where it is endemic. Normally, this is an infection that occurs in infected animals that can then pass on infection to humans, but the current outbreak is person-to-person spread. Monkeypox is an orthopox virus similar to smallpox and cowpox, but milder. The virus primarily spreads through prolonged skin-to-skin contact, large droplet secretions during close face-to-face contact, and sharing contaminated towels or bedding or utensils. Next slide. Monkeypox is harder to transmit than other infections such as COVID-19. And although monkeypox can occur in any population, the risk to the general population still remains low, but there are certain groups that should take precautions. For this current outbreak, it was reported in a recent morbidity mortality report by the Centers for Disease Control that among 2,891 cases reported in the United States through July 22nd, 2022, that 99% were male and 94% reported close intimate contact with another male. So we will certainly discuss prevention methods and how to keep safe from monkeypox. Other groups such as children, pregnant women, and the immunocompromised should also take precautions. The time from infection to symptoms is typically 7 to 14 days from exposure, but can range from 5 to 21 days. The illness typically is self-limiting and can last 2 to 4 weeks. Next slide, please. The rash of monkeypox has characteristically started on the face, spread to the palms and soles, and then the trunk. However, during this current outbreak, rash has appeared in the genital area or anal area first, or as oral lesions. It can look like other rashes, such as syphilis or chickenpox. Next slide, please. These are different pictures of monkeypox that have occurred in different persons. They can appear as raised bumps, as ulcerations, as scabs, and in different stages. Each of these different stages can still consider to be infectious or contagious. Next slide, please. Individuals who are sick with monkeypox symptoms or rash should isolate, stay at home, and monitor your symptoms. Contact your healthcare provider to get tested if you develop a rash. There is treatment available with an antiviral medication called tecovirimat or TPOXX. And this is for severe infections as well as painful rash. And inform your close contacts if diagnosed with monkeypox. There is a service available at www.tallyyourpartner.org to anonymously notify partners about monkeypox in a safe and secure way through text message or email. Next slide. If you have been exposed, individuals can get vaccinated. If you have been exposed, get vaccinated within the first 14 days after exposure. Monitor for signs and symptoms for 21 days. But if you are symptom-free, you can continue daily activities such as going to work or going to school. If symptoms develop, individuals should immediately isolate, contact your healthcare provider if you have a rash in order to get tested, and inform your close contacts if you are diagnosed with monkeypox. If you do not have a healthcare provider, we encourage calling 211 or 711 for the hearing impaired. This is our monkeypox dashboard, which talks about test, trace, and treat. As of August 8th, there have been 104 reported confirmed and probable cases of monkeypox with illness onset ranging from May 30th to August 4th. For trace, there have been 72 active contact investigations and a total of 177 contact incidents that have been investigated. Currently, antiviral treatment with a medication called tecovirimat is available through all 6 HHSA regions in the county. And to date, there have been 170 courses of tecovirimat distributed to area hospitals and healthcare facilities. Next slide. The antiviral medication tecovirimat can be used for monkeypox and obtained and we have obtained it from the Federal National Strategic Stockpile. This treatment is available for individuals who have severe disease and for those who are at risk of developing severe disease. It is available as a pill, and it also can come in IV formulations. And to date, we have distributed 170 courses to the pharmacies of hospital systems, community clinics, as well as our public health clinics. Next slide. So due to the limitation in supply of vaccine, the vaccine strategy as recommended by CDPH or the California Department of Public Health is to vaccinate as many eligible people with first dose of vaccine. When the supply is increased, and we hope that will be increased, then second doses will be provided to those individuals. And the reasoning behind this strategy is that there have been studies on smallpox vaccination, and this monkeypox vaccine has also been used for smallpox. But these studies on smallpox vaccination show that there is reasonable efficacy with just one dose for several months. And that second dose of the vaccine was given for prolonged immunity. But with one dose of vaccine, it has been shown that there is efficacy to give protection to individuals at higher risk. Due to the limited supply, vaccines are prioritized to two categories: for persons who've been exposed to a confirmed or probable case. This is post-exposure prophylaxis, or PEP. And for those who have underlying medical conditions that increase their risk for severe disease. This is known as pre-exposure prophylaxis, or PrEP. If you've been exposed to monkeypox, the CDC does recommend getting a vaccine for post-exposure prophylaxis, or PEP, within 14 days. And this may prevent someone from developing infection or reducing serious symptoms should infection develop. Currently, PEP is for people who have been identified by known cases as intimate or otherwise close contacts with the person diagnosed with monkeypox, and those who have been intimate or otherwise had skin-to-skin contact with a person who has a monkeypox-like rash. For pre-exposure prophylaxis, the strategy is for persons with immune compromising conditions, and you'll see a list of conditions on this slide, including persons with HIV or AIDS. I did want to let you know that there has been some guidance put out by the Centers for Disease Control for individuals with HIV infection and guidance related to monkeypox. The CDC does state that individuals with poorly controlled or uncontrolled HIV could have increased risk for acquiring monkeypox if exposed, or could be at risk for prolonged or severe monkeypox disease. Next slide. I'd like to focus a little bit now on vaccine. At this time, the federal vaccine supply for monkeypox is limited. Vaccine does come from the federal strategic stockpile. This vaccine then goes to states that do have monkeypox cases. And so this vaccine would go to the California Department of Public Health. California Department of Public Health will then allocate that vaccine to individual local health jurisdictions or counties. This slide provides a summary of our vaccine efforts. We have requested 26,638 doses, and we have received 5,047 doses from the California Department of Public Health. And this is based on a formula allocation, which does include monkeypox infections in the last 2 weeks within a county, as well as early syphilis cases in men. 4,647 doses have been distributed to hospitals, federally qualified health centers, and county clinics, of which 2,377 have been administered, and there are currently 400 doses reserved for post-exposure prophylaxis. Now, please welcome Patrick Losa.
Thank you so much, Dr. Kadakia. I am going to be talking to everybody about risks and sexual practices that place people at risk, and how particularly our gay, bisexual, and other men who have sex with men can reduce their risk. I do want to acknowledge something that our HIV planning group chair said at the beginning of this meeting, that this is a very difficult time. We are 2.5 years into a global COVID-19 pandemic, and now we are addressing a monkeypox pandemic that is right now spreading almost exclusively among our gay, bisexual, and other men who have sex with men. So And we've also heard from the chair at the beginning and from Dr. Kadakia that the vaccine supply right now is incredibly limited. And so we need to talk about how can we reduce our risk until the vaccine supply becomes more readily available to protect our community. So if we go to the next slide. These are the sex practices that are leading, that can create risk for monkeypox acquisition. I'm gonna start with the first three: oral sex, anal sex, vaginal sex. Now, we heard that right now in San Diego County, we don't have any cases in females. We hope that continues, and we hope that we can contain the monkeypox outbreak very quickly. But oral sex and anal sex in particular are the sex acts that are most commonly associated with monkeypox infection. And reminding us from what we learned earlier, the reason for this is they both involve generally prolonged skin-to-skin contact between someone who is infected and someone who isn't infected. Kissing also creates risk for monkeypox transmission. If someone who is infected and has sores in their mouth or in their throat, they can secrete monkeypox virus in respiratory droplets and in saliva, in reminding us that close face-to-face contact is a potential risk for monkeypox transmission. Unfortunately, hugging and cuddling without clothes is also a risk for monkeypox transmission, again, because of prolonged skin-to-skin contact. And even sharing sex toys can create risk for monkeypox transmission, as monkeypox can be on the surface of sex toys and then transmit the virus. So what can we do? Let's go on to the next slide. How can we reduce our risk? The first two is reduce the number of sex partners, and in particular, reduce or avoid anonymous sex encounters. When we look at people who are contracting monkeypox right now, the majority of them have multiple sex partners. And so thinking about reducing the number of sex partners and then reducing or even avoiding anonymous sex encounters can significantly reduce your risk. Some of the organizations across the United States working with gay men have even recommended considering forming sex pods, where you make agreements with sex partners that you will not bring anyone into that group. You will only have sex with the people within that group to reduce the risk that monkeypox becomes introduced into that group. Our next recommendation is to avoid group sex spaces. We've had several cases of monkeypox associated with group sex spaces, and so we recommend avoiding those for the time being until vaccinations are more widely available. The fourth one is very practical and I think very important, is talking to your sex partners. Prior to sex encounters, talk to your partners about your sex practices, ask them about their sex practices, ask them about their partners and how many sex encounters they've had. And when you meet, before the lights go out, you can check each other out, check for symptoms, check for signs. And if someone does potentially have signs of monkeypox, you can help each other to get connected to testing and treatment resources. Now, this next one is going to sound a little strange: condoms. I'm going to recommend condoms. Condoms are not 100% protective against monkeypox. However, they can help reduce your risk. Remembering that the risk of transmission is associated with contact, prolonged skin-to-skin contact, particularly with lesions associated with monkeypox. And unfortunately, you might not be able to see all of those lesions. For instance, if those lesions are inside the rectum, or if they're inside the pharynx of the throat, you won't be able to see those, but condoms can protect you from that transmission. I also want to talk about some things that we don't know yet. We do know a lot about monkeypox. Monkeypox, as you've heard, is endemic in Central and West Africa. However, how it is being transmitted now is not how we've been seeing it transmitted in the past, and it is behaving a little bit differently. We don't know if people are infectious prior to showing symptoms, and so that's why we recommend these harm reduction practices from the outset. We do know that monkeypox virus is found in semen. We don't know if it's found in vaginal secretions or feces or urine, and we don't know if the presence of monkeypox virus in semen right now can lead to transmission. So we don't know, but again, condoms can protect you and your partners from monkeypox. And so with that, I'm going to turn this over to my colleague, Dr. Winston Tillman, who's going to talk to you about what you can do if you are exposed or if you become infected with monkeypox. Thank you. Dr. Tillman.
Thank you, Patrick. If you are exposed to or develop monkeypox, please know that Public Health Services is here to help. First, we will make sure that you have the resources you need, including post-exposure prophylaxis, or in the case of rash or other symptoms, clinical evaluation, testing, and treatment if needed. If you are diagnosed with monkeypox, you may be contacted by a public health worker who may ask you about your recent sexual and other close contacts so that those contacts can be notified of their potential exposure. We will do this anonymously, meaning that we won't tell your recent partners who gave us their name, and we help connect them to needed resources, including testing and treatment or post-exposure prophylaxis. We understand that you may be reluctant to provide us with written names and contact information of recent sexual partners. We get it. We have a lot of experience, and we hope that you will trust us. As was mentioned earlier in the presentation, there is a website that can be used to anonymously notify sexual and other close contact partners of possible exposure, www.tellyourpartner.org. This will allow them to learn that they may have been exposed to monkeypox virus and seek the services that they need. Next slide, please. I think a lot of these points have already been covered, but as we wrap up the presentation, I just want to remind everyone of the 3 key strategies that can help to prevent monkeypox. First, limit close skin-to-skin contact with anyone who has symptoms or a rash. Second, know the signs and symptoms, check yourself and ask your partners about recent rashes and illnesses. And finally, obtain the monkeypox vaccine if you are at risk. Next slide, please. And as we conclude the presentation, I just want to remind everyone of the importance of trust and working together as a community to address this new public health threat. Next slide, please. And with that, I would like to thank all of you for your attention, and this concludes the presentation. I will now turn the floor back over to our moderator, Dr. Eric McDonald. Thank you.
Thank you, Drs. Wooten and Tillman and Kadakia, and also thank you, Patrick, for giving this very informative presentation. We received quite a few questions before this panel, well over 50, and they're probably still coming in. And as a reminder, you can ask your questions in the Q&A box, and we'll try to get to them as many as we can. And I'm going to start by just saying that the number one question that we asked, or that were asked of us, really boiled down to why is it so hard to find a provider to get the vaccine? And I think the answer is straightforward, and I'll let my colleagues elaborate. But if you saw the slide that Dr. Kadakia presented, the number of doses that we requested is probably about a quarter of what we might need to immunize the population, but it's 5 times what we've actually gotten so far. And much of that has been now committed to treating individuals who have been exposed. So the supply is much, much lower than the actual demand. So we've had to actually essentially prioritize them. So we're not giving vaccines by on demand. We're giving it by risk. And you heard what some of those risk profiles, medical conditions and behaviors are. And we know that assessing that risk requires asking some very personal questions. And it's important that people at risk go to their trusted providers to have those kinds of discussions, to decide if there's somebody who's at risk, and then be referred for vaccines as appropriate. And I'll see if any of my panelists, our colleagues on the panel, want to elaborate on why it's so hard to get the vaccine.
I mean, I think that you covered that answer very well, Dr. McDonald, that it is true that we have not, I mean, first of all, the issue lies with the federal strategic national stockpile not having enough vaccine. And then, of course, we know that there are multiple states in which outbreaks are occurring. And then, of course, we know that there are jurisdictions that are in need of vaccine. And so while we continue to request vaccine, we have received, unfortunately, a small amount of vaccine. And it is true that those individuals with who have been exposed to those that are confirmed or probable monkeypox, we do want to make sure to have supply for them as well.
You know, a follow-on question that we got during this session and actually before this session was that the White House announced on Tuesday the dosing scheme of 1/5 of a dose of that has been previously recommended to be given basically between the folds of the skin or intradermally instead of subcutaneously, and that might effectively quintuple the amount of vaccine that's available. That's really good news, but it is something that's just been announced. And I wonder if you can comment about what the county is doing to actually prepare for that.
Yeah, that's a great question. By doing intradermal injection, this would allow for 5 doses in a vial of vaccine. And so the county has gone ahead and ordered the needles and the supplies needed, and we are making preparations. But however, we are still waiting for the guidance from CDPH and CDC in determination of how we would appropriate that vaccine. But yes, that is one way to increase vaccine supply by providing it intradermally.
And Dr. McDonald and Dr. Kadakia, just to add to that, just today, our state health officer issued an update, and they are supporting this strategy from CDC to inject the vaccine intradermally as opposed to subcutaneous, as stated, expanding it, the 1 vial dose to 5 doses. So we are, in addition to the comments made by Dr. Kadakia, we are also planning the training efforts to support this change in vaccine administration strategy. So that is good news. Still will not provide the overall number of the supply that we need, but it does expand. So all of those efforts are currently underway.
Yeah, I think that's a really great point. And it probably will take a little bit of time to sort out to make sure that the vaccine can be given safely and effectively under this new authorization. Dr. Kadakia, how did this virus come about? Why is it spreading now? Maybe I know that it's a little speculative, but a number of people have asked that question. Is this something that's mutated from something that's before? And is it more contagious for some reason? What's known about that?
That's really a great question. And so really what's happened here is we know that monkeypox is spread through that direct skin to skin contact. And that's really what we're seeing, the person to person contact. The rash itself is contagious, but sometimes individuals may not know that they've come into contact with that rash. So it's really important in terms of those prevention efforts to speak with your partner, to look at your partner and to discuss whether you've had a rash or a recent illness, because part of that conversation is part of prevention. So why is it spreading now and has it mutated? This virus is different from COVID-19. I think that is a question that we get a lot. And COVID-19 is more infectious than monkeypox. Because remember, monkeypox is that direct skin to skin contact. That is the primary mode of infection. And then of course, like close personal contact, the face-to-face contact that can occur with kissing or being intimate with someone. And then the sharing of bedding or towels that have been contaminated by someone who has the rash and that has come into contact with their bedding, and if someone else is touching that bedding. It's yet to be determined if the current strain of monkeypox is more infectious. We do know that it does mutate, but not at the same rate that we have seen with COVID-19 and the multiple variants that are there.
Thanks. Another question is, if you've had chickenpox before, am I more or less likely to get monkeypox? Even though they both have pox in their name, they're actually very different viruses. Chickenpox is a herpes virus, and monkeypox is an orthopox virus. So they have rashes that might appear to be similar just on casual observation, but they're very, very different. But another question is that we've gotten is a very good one. For those of us who are old enough to have been vaccinated against smallpox, or perhaps were vaccinated in the military, are we protected against monkeypox?
This is Dr. Wooten. Yes, there is some protection there. And I also want to remind people that in early 2000s, when there was the anthrax scare, many healthcare professionals obtained a smallpox vaccination. Sorry about that. So there are some of our, and I obtained one of those vaccinations as a public health official at the time. So, but there have not been any studies really currently related to this outbreak to show what that protection factor would be. But there is some protection that is conferred if you have been previously vaccinated for smallpox.
And I will just add to Dr. Wooten's answer that if you have been exposed during this current monkeypox outbreak and it has been more than 3 years since your last smallpox vaccination, we would recommend vaccination at this time for exposure.
I know I'm asking lots of vaccine questions, but that was the bulk of what people are concerned about. But maybe I can ask a different question here, and this one might be best for Dr. Wooten. The question was, can we really contain monkeypox if we aren't supporting people who might need support if they have to isolate for a long period of time or perhaps quarantine for a while?
That's a great question, Dr. McDonald. First, I'd like to just inform people that, as Dr. Kadakia stated, monkeypox, the way it's spread is different than the way COVID-19 is spread. COVID-19 is spread potentially through aerosol as well as droplet transmission. Monkeypox is primarily spread through skin-to-skin contact. So people who are infected with monkeypox can safely isolate at home, adhering to safety precautions. For those people that have shelter insecurity, the county public health has long had, even before COVID-19, an infectious disease temporary housing program. We do this for tuberculosis, and we've done it for other communicable diseases like Shigella last year during the Shigella outbreak and other infections. So we do have a temporary housing program for individuals that would need housing for isolation for this disease if they are homeless or cannot safely isolate. And we are looking at expanding resources to provide these efforts to our community San Diego residents. But we do not anticipate that we will have the same number of potential need for room and board due to monkeypox as we did with COVID-19. But we are preparing, as our agency director says, we are preparing for the worst and hope that we don't have as many as we could potentially have if this really expands. So we are prepared for this.
Thank you, Dr. Wooten. A question that came in while we've been talking here is, are people who aren't men who have sex with men being given access to tests if they're having symptoms. And I do want to address that. I mean, that gets at the idea that only perhaps a certain group is being tested, and that's the only results that we're getting. And absolutely, individuals who have signs and symptoms that are consistent with monkeypox, most of whom have known exposures to those who have the disease, are being tested. We do know that the test is available, for example, through Rady's Children's Hospital and their supporting laboratories, and commercial laboratories throughout the country that support all of our federally qualified health centers and points of access for care. But the question is interesting because it leads, I think, to another question, which is, since most of these cases are in men who have sex with men, why should other people be concerned? And maybe that's a question I can send to Mikey. It might be good for you to answer that one.
That is a great question. And what comes to mind is, just to remind everybody what you've heard through the presentation, is that this is a skin-to-skin contact. It is not a sexually transmitted disease. And we need to get that message out to the entire community. It is not a sexually transmitted disease. It is a skin-to-skin contact, or through the clothing of somebody who's infected, or the bedding in that. So we need to be very careful. And so I would encourage all members of the community, find out about monkeypox, check the county website, and learn how you can protect yourself and your loved ones, because you could have somebody who comes down with monkeypox that you're close to, and you want to know, what are the risks that you could encounter? What can you do to prevent yourself? So this is not, this is for everybody. It's not just a one thing like it was in the early years with AIDS, where it felt like the certain portion of the community was being ostracized because, oh, it's a gay disease. Well, it's not a gay disease. Monkeypox can affect anybody. It does not discriminate.
If I can add too, that really when one part of the community is affected by a communicable disease that can potentially affect anybody, everybody should be concerned. That's how I would sum it up. And anybody else want to make any comments on that?
Dr. McDonald, I wanted to go back to the test. People might not realize that when we talk about testing for monkeypox, you have to have the rash, the characteristic rash that has been described by Dr. Kadakia. And so culturing the blisters is necessary to confirm the diagnosis. So just wanted to point that out, so people don't go to their doctor and say, I want to get the monkeypox test. They really need to have the rash that we've described in order to be tested.
Yes, thanks. Again, for one of the rules we learned in medical school is common things are common, and it's outside the current groups that are being affected is very low likelihood that a rash would have that. But again, that's a reason to be having a number one, a good source of care, and then accessing that in order to get testing as needed. Another question that came in is, what's being done to prepare schools and daycares and other locations for possible monkeypox outbreaks? And maybe I'll start before turning it over to my public health colleagues. This is a skin-to-skin transmission illness, and there are other skin-to-skin transmission illnesses that have been present in schools and daycares for years, whether it's molluscum contagiosum or MRSA or lice or other things. I mean, again, schools and daycares actually have very good procedures in place in their normal infection control to be able to deal with possible skin-to-skin transfer illnesses or conditions. On top of that, they've done some amazing work to prepare because of COVID-19. And really, one of the messages is, if you're doing a good job to protect yourself and your business place or your school or your daycare for or against COVID-19, you're doing a very good job for monkeypox also. And if my colleagues from public health have any additional comments, please jump right in.
Thank you, Dr. McDonald. This is Dr. Wooten. Also, just want to let people know that in addition to what Dr. McDonald has shared, we've actually sent out letters to various sectors, including school district nurses, as well as institutions of higher education, our colleges and universities. the disease is currently in the men who have sex with men or gay and bisexual population, but has been stated and inferred already, if we don't contain this, it can spread into other populations. So we want everyone to be educated and aware of how to prevent the disease and how to, and actions that they should take if they are exposed. Because again, the infection can impact everyone. So information has been sent out to schools, to businesses, chambers, as well as our healthcare systems. And we just want everyone to be informed about what they should do if they are at risk. Thank you.
Thanks, Dr. Wooten. Another question that we got was, how do we, might we handle a monkeypox outbreak in a long-term care facility? And again, the preparations that most of our long-term care facilities have made in this fight against COVID-19 are going to help them greatly. But I will add that unfortunately, in the last couple of years in Southern California, there has been another skin-borne issue in some long-term care facilities, a disease called Candida auris. And again, the local long-term care facilities have gotten very good at the proper cleaning and bedding control procedures for that particular fungus. All that transfers beautifully to good preparedness for monkeypox. And you might sense a theme here that some of the things that we already do, some of the things that we've already recommended in terms of just personal protection and behaviors actually work very, very well to protect against monkeypox exposure. A question came in about the number of cases that might be seen and affecting the local business community, in particular LGBTQ establishments or those that gear themselves to that specific population. I wonder if the public health team could talk about some of the outreach efforts that have been made there.
We have, that's a really great question. And we have done a lot of outreach. We've partnered with many of the LGBTQ organizations in order to provide monkeypox information and flyers. We actually are going to have a Live Well van at the City Fest Festival this Sunday in order to provide monkeypox information, flyers, be able to answer questions. And so it is obviously, I think the best way in terms of outreach has been by providing education and prevention information. We've also hosted and have been hosting every Monday LGBTQ telebriefing. This is a new telebriefing that we've added in addition to the many other telebriefings, including the business sector, homeless outreach workers, in order to continue to provide information in a timely manner. We've also have information available on the county's monkeypox website. So as information gets updated, we are updating that website Monday through Friday in order to provide information. And then also making sure that if you are a business, do use our text message alert system in order to receive timely information as well. And we can put that into the chat pod. But those text message alerts also go out with information related to monkeypox. We've sent a number of letters with prevention and information for monkeypox, including to the chambers, which would be available for businesses. We've also sent information out to colleges and universities, to healthcare centers across San Diego, as well as child daycare centers and universities and colleges. So making sure that we reach all businesses, all individuals that could be affected with information about how to prevent this disease and what to do if you are exposed.
Thanks, Dr. Gadakia. Another question we got is the term PrEP in the LGBTQ community has a familiar relationship to many because of HIV and AIDS prevention. And the CDC and other websites mentioned PrEP, and you did also, Dr. Gadakia, for smallpox and monkeypox. I wonder if you could just elaborate a little bit on that. Sometimes that might be confusing for some, and I think it's good if you just reiterate, what does PrEP really mean in this context?
Yeah, that's a really great question. I was actually an HIV provider for many years at the Owen Clinic, and so I have myself given PrEP to many patients. And PrEP stands for pre-exposure prophylaxis, and so this term pre-exposure prophylaxis can be used for any disease, and it has been used for several diseases in which we want to protect individuals who are at higher risk of acquiring a disease. So that is true for HIV, but it is also true for other infections. So this terminology can be used for other diseases. And in general, pre-exposure prophylaxis is the term that we use when we are discussing providing prevention or for individuals who might be at higher risk of acquiring an infection.
Thanks. This is a question I definitely think is coming through the lens of COVID, which is, very understandable because of what we've been through for the last 2.5 years. But what are the odds of a breakthrough case on a vaccinated person for monkeypox? And that's the way the question came in, but I just wanted to maybe let one of our infectious disease folks unpack that one. Maybe Dr. Kodaki again, and Dr. Tillman is also an infectious disease expert.
I can take a stab, and if Dr. Tillman would like to jump in, he's more than welcome. So it really has to do with the timing of getting a vaccine once you're exposed. We know that individuals who are able to have a vaccination within 4 days after exposure have the best chances. However, we can give vaccination to individuals up to 14 days after exposure, and that can limit the severity of disease if they were to have breakthrough infection. But also there is a good chance of not acquiring the infection at all with vaccine. So it really depends on individuals being aware that they have been exposed, and then making sure that they're connecting with their healthcare provider in a timely manner.
Oh, sorry. Apparently they didn't hear that last question. Okay, I'll start over again. I'm just again sharing the questions amongst the panelists, and I'm sorry I'm messing myself up with the audio video visual here. What do we really mean by prolonged skin-to-skin contact? That was something that was in the presentation and might be a little nebulous to some, but I wonder if you could elaborate on that.
Thanks so much for that question, and recognizing that I don't want to give an exact amount of time, but thinking about when people are intimate with each other, when people are having sex with each other, contact between skin can endure for 10 minutes, 15 minutes, the entire act. So we're talking the lesions themselves are what contain the monkeypox virus, and they need enough time to have contact with some other surface on the person's skin that might have like micro tears that you can't see, but allow the virus to get into the skin. So it's that amount of time. Casual contact, like a fist bump, is unlikely to lead to monkeypox transmission, I believe, and one of my colleagues will correct me if I'm wrong, but it really does require some prolonged contact. And I don't know if there's a time, Pete, that you could add to that, either Dr. Kodaki or Dr. Tillman.
Yeah, so thank you for that. I do want to just add, so what we mean by prolonged face-to-face contact or prolonged skin contact, and really the prolonged contact has to do with being in close face-to-face proximity for that droplet spread. And normally when we say prolonged, we were thinking 3 hours. That's what we've seen generally in the cases reported in transmission that way. But really, this is not just a casual kiss on the cheek. This is, having intimate physical contact with someone. So not necessarily just casual contact.
Thanks. We had a good question about the possibility in the future of additional community-based vaccination events, or otherwise known as mass vaccination events. And I think that I'll again turn that over to the public health team to see if they can give us some information about that.
So Dr. McDonald, I do know that additional, we call them pods, points of dispensing for the vaccines, they are being planned. When we have specific dates, we will post that information on the monkeypox website.
I think also that, again, knowing the amount of vaccine that we have available and knowing that there is this uncertainty in this short period about whether we might be able to expand the number of people who are vaccinated with this 1/5 dose. Once we have sorted that out and perhaps come up with a good, strong procedure to do that kind of activity in a mass event, it might be more likely to have a successful mass vax event. But really, most of the vaccinations that are occurring right now are occurring in the clinics that are serving the population at highest risk. And as I referred to before, it's determining that risk and making a valued judgment as to who is highest risk to give the limited number amount of vaccine that we have now. Just a quick question, can hand sanitizers and hand soap kill the monkeypox virus?
Yes. So again, prevention is key, and washing your hands even after even after sharing towels, sharing bedding, being in contact with somebody. Hand sanitizer with 60% alcohol also is effective at killing monkeypox. So if you've got, similar to COVID, if you've got hand sanitizer or gotten used to frequently washing your hands with soap and water, that is similar advice that we'd give you for monkeypox. Additionally, there is advice, per the CDC, that if you are sharing sex toys, if you are sharing bedding or clothing, or after intimate physical contact, that you should wash your hands, wash those sex toys or any bedding or clothing that might have been used, or use hand sanitizer.
Thanks. Again, I think we've talked about the possible need for support of individuals who are affected by monkeypox and the prolonged amount of time that they may need to be isolated and quarantined and perhaps unavailable for work. And so a question came in about what about income supplemental support for those that can't go to work because of quarantine or because of isolation? And the county is, I'll answer that question. The county is advocating at the state level for funding that would allow us to actually conduct that type of program. We are in touch with the providers in the cases of the ones that we've had so far. And there are some cases that have had some very specific needs. We've been able to meet most of those needs to date with very simple types of connecting them with available resources in the county. But it is very possible that this type of program might be needed as the numbers go up. And we are definitely advocating for that at the state level. Let's see. The question about
Dr. McDonald?
go ahead. I'm sorry,
Yeah.
Dr. Whitten, please go ahead.
Can I just add to that? We certainly did provide assistance during COVID-19 because all of the funding that came down the pike from the state. While we have declared a national emergency, a state emergency, and a local emergency, the same type of funding that was associated with COVID-19 has not yet been established for monkeypox. So just wanted people to understand that as well. But as Dr. McDonald stated, we are advocating for this resource because we recognize that the time that someone would need to isolate is actually much longer than you would need to isolate for COVID-19. The disease, the monkeypox disease, can take anywhere from 2 to 4 weeks to clear. So if you are infected. So we are cognizant of the needs for those people that are infected, the need for those that are exposed. They need to be quarantined for 21 days. So we are aware of all of that, and we recognize that support will ultimately be needed for individuals that will have to take that time off from work. Thank you.
Next, we have a question about treatment and the treatment. Actually, I was enjoying for people that are looking at the live transcript, the way that the transcriptionist converted Tecovirimat into common language was Tech of Vermont. I thought that was actually pretty funny. Sorry. Is there a list or how do people get access to Tecovirimat, or otherwise known as TPOXX? And how is the county involved with distributing that out to the community?
So again, that's a really great question. And we are working on being able to put that information available, but we have distributed over 170 courses of Tecovirimat to healthcare systems, as well as to FQHCs and clinics, hospitals. So it is available. And if an individual does need Tecovirimat or would like to know if they can receive Tecovirimat, the best place to start is by calling your healthcare provider in order to be determined whether you would need to have Tecovirimat. And that being said, again, we have Tecovirimat available for individuals who do need it.
Thanks. And I wish I had put all of these questions into big buckets like testing and vaccine, but I'm looking at them coming in as they come in. And so these do seem like they're a little out of order, but that's okay. So the next question I have is actually has to do with this 1/5 dosing intradermal. And we've had a couple of questions about the efficacy or how well does that work? And again, I wonder if one of our infectious disease doctors can address that question.
Yeah, again, great question. And so we do know that there was a study in 2015 that did look at efficacy of using a 1/5 dose, and it did have reasonable efficacy. And so that is why the government did consider doing this 1/5 dose, because we'd be able to give more doses at a reasonable efficacy to individuals to provide immunity during this current outbreak. Obviously, when we are able to have enough doses and someone can have 2 doses of this vaccine, which is given 1 dose 28 days apart from the second dose, that would confer having longer, possibly multi-year protection. But for the current outbreak, in order to have protection during while this outbreak is going on is also very important. So being able to do the 1/5 dose in order to get more vaccine into more arms can be a good strategy.
Thanks. There are questions about when is somebody really contagious? And I know that that's a question probably brought out by the history of us understanding more about COVID over time and the possibility of people being contagious when they didn't have symptoms. And so I wonder if someone can address that question about if the quote virus is in your system, but you don't have symptoms, does that mean you can be contagious to others? And how about when people have rash, and how long after they have rash?
So I'm going to try to take that one too. We know that, currently it's unknown when individuals have symptoms, whether they are transmitting the virus, but we do know that the rash itself of monkeypox is infectious. And so that's why that direct skin to skin contact is what we're seeing as the primary mode of infection. So the rash is infectious until the the rash has healed over completely. And this is similar, I would say, to if you had chickenpox as a child, you were considered infectious until those lesions healed over.
Thanks. And we talked about how monkeypox can spread in contaminated bedding or towels and that sort of thing. But do we need to worry about other common surfaces like pens or clipboards or swimming pools, bodies of water? How concerned should we be about that type of exposure in the environment?
This is Dr. Wooten. As was stated earlier, you cannot, because the route of transmission primarily is close skin-to-skin contact. Touching a doorknob is not a way that you're going to be infected with this particular virus. So again, reemphasizing the mode of transmission, close, sustained skin-to-skin contact, face-to-face contact because of the droplet transmission, and then transmission via fomites, which is defined as clothing or bedding or contaminated materials. So the general population, there is a very low risk of transmission from touching doorknobs or things of that nature. It really is that primarily skin-to-skin contact, close face-to-face transmission, or exposure to bedding, clothing that's been contaminated with the virus. And I've also reminded people, and this might not be a pleasant example, but historically, we remember how Native Americans were infected with smallpox through contaminated blankets. That's the fomite transmission. So it's just understanding your history also is important here. Thank you.
Thanks, Dr. Britton. Actually, good question. If community partners and individuals want to partner on just increasing preparedness for monkeypox, what should they do? And actually, we have an email that we can send to you here in the chat. I could read it, but I would probably mess it up. So I'm going to let people look at it in the chat. But also, I just want to emphasize that really throughout COVID, we have had a communication network with the various sectors to communicate the rapidly changing information about COVID. And I think that you can probably sense from just this phone call that there's been rapidly changing information just this week. And so, in addition to signing up for the text alerts, you could sign up for one of those ongoing series of sector calls. We actually have ones for business, schools, universities, faith-based community, tribal nations and governments, healthcare, homeless service organizations, organizations and those who are interested in the care of older adults, long-term care, LGBTQ and community-based organizations, all those different sectors. We've been regularly communicating about COVID. We've actually now started to introduce the updates on monkeypox so that everyone can keep up to date. So somebody needs to give me a thumbs up that the link has gone into the chat. Okay, for the
Dr. McDonald? Yes.
Okay.
There's a link that's in the chat. If people want information about preventing monkeypox in group living settings or any other settings, general information, if they want to ask general questions, there's information in the chat about an email that they can contact to ask those questions, and responses will be provided back to them. Thank you.
Thanks. Wrong button. That's something I do. Sorry. Let's see. A question perhaps for our leadership from HSHB. I wonder if you could just make a comment or two about monkeypox in the context of just sexual health in general, and having a reliable source, a trusted source for that. I think, again, this is just one of many examples of several challenges in this area over the years. I just wanted to give you a chance to talk about that.
Thank you so much for that question. And yes, it's a vital part. Our overall sexual health matters, particularly in our gay, bisexual, and MSM communities. Our sexual health matters. And part of sexual health is understanding how risk gets created. We've spent some time tonight talking about the risks of monkeypox and how you can reduce your risk. And there are other risks that we face in our community, including HIV, syphilis, gonorrhea, chlamydia, some other sexually transmitted diseases, and understand understanding how people can protect themselves is really important. How they can reduce their risk for becoming infected with that is really important. And also making sure that you are connected to a really good healthcare provider who understands sexual health, where you can talk about your sex practices and you can receive testing if you feel that you've been exposed. Those are, I think, really important components of our sexual health. And I'm wondering if Dr. Tillman has anything he'd like to add on to that.
I think you covered it really nicely, Patrick. Echo everything that Patrick said about the importance of, I hear a little bit of an echo, sorry. Having that safe space to address sexual health issues. Also, I just want to reiterate the importance of other sexually transmitted infections that can often present in similar ways to monkeypox and are part of the what we call differential diagnosis of monkeypox, and to seek testing not just for monkeypox if there's a concern about that, but also other infections that could be mistaken for monkeypox, and which would require different treatment strategies.
Dr.
Thanks.
McDonald?
Oh, go ahead, sorry.
Yeah, I just have one comment in terms of, you mentioned the fact of a trusted entity. I just want to reemphasize to everyone out there, if you are called by a public health case investigator, if you've been diagnosed with monkeypox or any other infectious disease, communicable infectious disease, please take the call. Please talk to the public health official that's contacting you, because this information is how we help to inform the community about the characteristics of any given infectious disease. And we need to do this for monkeypox as well. So don't hang up on them. The information that you provide is confidential. This is our bread and butter work. This is what public health does day in and day out. So please trust the process and trust the fact that nothing that you can no information that you provide to the caller from our public health department is going to be disseminated elsewhere. This information is all confidential. So please take our call. Thank you.
Yes, thank you. Actually, I do want to thank all the patients and the contacts that we have actually contacted so far over time. This has been a tough time for them. I know we've talked about how the disease is self-limited, but that doesn't mean it's not very impactful to the people that have it because of the things that they're unable to do, because of the pain that they have. We do have some cases that have been admitted to the hospital, and there are other very unfortunate outcomes across the country of prolonged illness. Fortunately, no deaths in the United States, but again, this is a very impactful illness. And so I'm going to have a couple minutes to wrap up. I'm going to see if I'll give Mikey a chance to say if there's any last minute things that he wants to make sure, if there's one message he wants to get across, what should it be?
Thank you, Dr. McDonald. The takeaway message, and this is for both those that are watching and for the participants, collaboration. There has to be collaboration between what the county is doing, what the city is doing, and what the community is doing. There has to be collaboration because it's the only way we will stop this from getting bigger. Communication has to be open and it has to be honest, and each one of us has to make sure that we are very clear in what our message to whoever we're talking to is, respectful of each other. And the last one is education. You've heard over and over, there was websites you can go to educate yourself. You can reach out to the county and ask questions. We need to educate ourselves, and we need to educate the entire community, because just right now you've heard several times throughout the presentation that just because one part of the community is being infected does not mean that it couldn't end up affecting the whole community. So when one part of the community is hurting, the whole community should come together and help that part of the community get through the tough times. So my takeaway message is concentrate on communication, concentrate on collaboration, and concentrate on education. Thank you.
Yes, thank you. That's a great note to end on, I think. And I would like to thank, frankly, everyone who's participated. Number one, the panelists. I want to thank our director, Nick Machione. I'd like to thank our elected officials who made introductory comments here. Also want to thank the team who's been supporting this. I'm looking across the hall here or the room and seeing some smiling faces of people who've been writing questions down. We did not get to all the questions that people asked. And so we're compiling them. And we do have a Q&A resource on our monkeypox webpage in which we will attempt to address all of the ones that you've asked that we have not answered here. I want to thank the interpreters who've done an amazing job. And I can tell you that I think there were at least 2 or 3 times we were told to slow down with our medical language to make sure that our interpreters to keep up. It's a very challenging job. And I truly thank each and every one of them. I'll end by thanking you for tuning into this call. It's indicative of your interest. And I hope that you have learned something here that you can then amplify in your communities to spread the word on what monkeypox is all about and how we can be involved to stop this outbreak in its tracks. On the final slide here, as you're signing out, you can get text updates by texting COSD monkeypox to the number provided, and you can use your camera to look at the QRS code to go to our website for more information. In addition to signing up, I hope to one of the sector updates that I gave you earlier. So again, thank you so much. And that concludes our town hall for today.